So welcome to Albany County Direct. I'm your host, County Executive Daniel McCoy. In today's episode, I'm joined by two special guests, Chief of Police for Albany Police Department, Brendan Cox. So thank you for being here. And our Albany County Department of Mental Health Commissioner, Dr. Giordano. So thank you both for being here. But before we get started, could each of you just tell us a little bit about both yourselves? Now, I know we could be here for hours, especially when the cops start talking. We'll be here for a longer time. But Chief Cox.
So thank you very much. I appreciate the invite here, Mr. County Exec. So Brendan Cox, I'm the Chief of Police here with Albany. This is actually my second stint with the city. I'm very proud to be back. Grew up here in the city. Wound up ultimately being born and raised here. Grew up, wound up going away for college, came back, became a police officer, was here from 1994 to 2017, rose up through the ranks. Actually got a chance to go work for the National Lead Support Bureau from 2017 to about 2024. And then Mayor Sheen asked me to come back on an interim basis. Came back for what I thought was going to be a year, and then Mayor Pleers asked me to stay on. And quite frankly, just enjoying my time with the department. So decided to stay on and continue to work for this great city.
Well, I was chuckling because I was there at your swearing in, and I was glad to see you come back. I do like the fact that you call him Mr. Executive. So I grew up in the city, I've known your whole family, so it's nice. I'm going to take that tape and show it or let the rest of the family hear it. But I just remember saying to myself, "Oh no, don't ever do that. Don't say 12 months," because I know your heart and dedication is not just for the Albany Police Department. That's transparent. But for the city residents. And I remember when we started LEAD, I'm like, where is he getting this from? And you brought all the different organizations in, and it was something new to us. And we weren't used to that approach, and you had to win everyone over, which is not easy when it comes to politics or explaining to people you want to try something different. And here we are, and that's what we're going to be talking about a little bit. But thank you for all that. Dr. J.
Do I have to call you Mr. County Executive?
No, not at all.
Boss. Listen, you've kept me around for a long time. I've been your commissioner for mental health for 15 years.
Doing an extraordinary job, too.
Well, listen, that means a lot to hear that. I've been with the county for 38 years. And, it's I'm very grateful to have been serving you and the residents. I'm a psychologist by training. And I think we're doing great things in the Department of Mental Health. LEAD is one of them. I'm New York City born and raised. Went to college at UAlbany and never left. So, and you seem to want to keep me around. So
Well, I want to tell you what you do such a great job, but I don't want to have to give you more money. So I'll just leave it at that.
That's fair.
But I do want to say it's neat to be here with two extraordinary people that love both their careers, separate careers, but who would have thought? That you're coming together with mental health in the police department and trying to figure it out. And unfortunately, after COVID and before COVID, it's the world we're in, and things need to be addressed differently. And that's the hardest thing in my opinion, when you look at the way we arrest people in this country, put them in prisons. We're pretty good at that, right? For being such a small country. And you look at how other countries handle it and thinking outside the box and doing initiatives that I'd probably be run out of office if we want to do some of that stuff. But if you look at the rate of reoffending and coming back out or starting a new life where you can't put a dollar amount on that. I say that all the time, even with mental health. You can't put a dollar amount on someone's health and well-being, because we could sit there and speculate how much money we save if they stay out of the system, they get off of probation. But at the end of the day, we don't know. So I can't believe it's been 10 years with LEAD. It feels like yesterday when you sold us all on this idea, and we started to go down this road. And I just, being a fireman and not being a police officer, but having family that have all been cops, it's something I never dealt with. And when you convinced us all and got everyone on board, we were like, this isn't going to work. And who thought, here's a great program that took time to get off the ground, stumbled a couple of times. And I always say that to people. I don't want to fail. I don't want to stumble. But what we're doing is not working. And it's easy to criticize a program or criticize if something goes wrong. It's harder to fix it. And they're the people I want to listen to and talk to and in partnership with, like this right here. Because, in any new thing we try in government or in private sector, not all the time going out of the gate, it works 100%. And you got to critique it, and you're like, all right, that was kind of a failure. Let's, move it this way, and it works. But I do want to get into it before I get in. We can talk stats all day long and the impact that has had. But Chief Cox, it is very interesting all these years later. And then when you left lead to come back, I'm like, you really were. I hate to say this, you're a hell of a chief, but you really ran a great program, not just in Albany County, across the Capital District, but across the nation, and represented us well. To see you come back was kind of surprising for him. Like, there's no way he's Mr. Leeds. He's not leaving. And here you are. What do you say to all that 10 years later? Did you think it was going to be this successful?
So, I knew that we were going to get a lot of wins. I think that if you asked me whether we were going to be doing this in 10 years, to your point, you know that no initiative is perfect, and you know that it's going to be a lot to get off the ground. I think that in our history, we saw a lot of things kind of come and go. So to be here 10 years later and know that we're still in existence, that we're still helping people out, and that we're still learning from what we do and know that we can make incremental changes and make things better, I think that's the learning point that none of us probably thought that we'd see today, nor that we'd have so many partners, the county, Center for Law and Justice, New York State, all the different agencies,
Trinity Alliance,
that have fought and said, we can't let this go away. Whatever we need to do to figure out the funding, to figure out the providers, and then to continue to find different innovative ways to make sure that we're providing service to people. I think that's what I would never have guessed in my wildest dreams.
I just want to, I just like to add, this was remarkable because this was an idea that turned into a thing. And 10 years of operations, but you and I both remember, we spent 2 years before we launched trying to make this into something. And you've always said, Dan, that it's about people and collaboration. And that's what there were some remarkable people at the beginning, and we've been friends for a dozen years. So it's just celebrate 10 years, but recognize that it wasn't a light switch.
No, I agree with what you're saying, because I always said, everyone, you can get the most negative situation, program go sideways, and I'm like, okay, what's the lessons learned? Take the positive out of it, because there's always some positive. It's hard to find sometimes in a negative situation. It's easy to be the Monday morning quarterbacks when they want to call us out, and they get fixated on maybe one or two didn't work out, right? But can we fixate on the ones that have and turn their life around and moved on, and you don't even hear about them, right? And that's the good thing. Or they're like, hey, I'm living a private life now. I don't want to go back to the mistake I made in life. I got past that. And they're the stories we like to tell, but it's easier for the naysayers or the non-believers to point the finger. And I remember, they're like, what happened to Chief Cox? He was so, he's Mr. Progressive now. And I used to just laugh. I'm like, no, he's just being vision and has a vision to saying, hey, what I've been doing, and that's not easy, to be in law enforcement like yourself or Dr. G, and say, I'm going to pivot and try something different because I've watched this system. It's not working. Let's try something different.
There were naysayers at the beginning. I remember the day after the first press conference, the radio in the morning, they were talking about another Hug a Thug program. And I was like, come on, we were all doing this work before. We just hadn't brought it together.
Yeah. When we started this, and especially, as we were talking before this, I was assistant chief when we started this, when we started looking to do this. Steve Krokoff was chief, and we were going around to community meetings. And this is really before the opiate crisis had hit us. So, a lot of people think that LEAD was a reaction to, people were overdosing and dying and we needed to change. And we were actually ahead of that curve. We were recognizing that, no, we're actually just treating people with addiction and mental health and poverty in a much different way than we're treating the rest of the population. And we were going around to community meetings and people were saying, like, hey, can we do something different? Like, you're arresting people 40, 50, 60 times. We're not seeing change. And what we're actually seeing is that this is a barrier between creating better relationships between the police and the community. So what if we did something different? And Dr. Green actually was going to go to a presentation from the folks in Seattle down in New York City. And she said, well, why don't you guys join us and come down to New York? Let's see the presentation together and let's hear what they have to say. And I remember being in the meeting and Steve Krokoff turned to me and said, what do you think? Is this doable? And I was like, we can do this. We can get this off the ground and we can no offense to the people in Seattle, I worked with them for a lot of years, but I said, we can do it better. We just have to do it a little bit different.
I was going to bring that up. Remember you saying that. I remember you saying, we're going to do this better.
Well, one of the things that I'm the most proud of is not only did we do it better, they were the first to launch. We were the third behind Santa Fe to have the idea, second to launch, but we were the first in the nation to bring mental health into LEAD.
Right.
And it stayed. And that makes me very proud to be part of this.
Yeah.
No, and I like what you said, because I did this whole equity agenda with Dr. Green, and I truly do miss her and her impact she's had and will have on this community going forward. But we took it from there. And when I travel around or we look around this country, not every model fits perfectly, but you got to adjust it what fits, or you say, hey, I like this, I'm going to add on to that. And that's what we did with the equity agenda. And the same thing, I'm glad you brought up about the mental health. Mental health goes hand in hand with people getting arrested. Not all the time, but I always say it's built in their character, right? We all grow up with great families, and then you see that one brother or sister, you're like, where did they find him? Like his DNA is like off the charts compared to the rest of the family. It's just sometimes the friends you hang out with, the problems you get into, or you just go down the path because that's who you are. But how do you redirect that? So I would say, why has the partnership with so many different organizations been so important to make this successful? And I know you both touched on this a little bit.
Well, I would just say that this is a natural partnership. Our mission has always been to address the fact that mentally ill people were disproportionately getting arrested. And there are a lot of reasons for that. There's a lot of problems in the system. There's not a lot of resources. The hospitals churn people through the emergency rooms, eventually get arrested. But we've always known that, and we've always been trying to address that. So this was a natural partnership for us. And from our standpoint, these agencies we had touch points with, so it was that we brought them together.
Yeah, I agree 100%. And I think what people sometimes miss, and I think what we've missed in both the criminal justice system and public safety overall, to your point about being a fireman, we're the first responders.
Yeah.
We're not supposed to be the last responders. We're not supposed to have the solution in hand. So if we don't have the collaboration, if we don't have the partnership, if we don't know the folks at Albany County Mental Health, if we don't know the folks at Catholic Charities or at St. Catherine's to be able to go like, hey, I've got this person, this is what's going on in their life. I can't fix this on the long term. All I can do is be here. I can either throw a Band-Aid on it, which, let's face it, most of the time that's what jail is, or I can say, like, can you work with this person for the long term and try to stabilize and get this person's life turned around? Then all we're going to do is just continue to respond, and never fix. So those collaborations help us fix. And that's where we got to get to the point of, we have to continue to improve on it, and we have to continue to have those partners come in and continue to learn from it. And I think we try to do that on a daily basis. But we're the first response. We're not the second response. We need to have that second response, and that partnership is that second response.
I 100% agree with you. And, I just, some of the stats from the press conference, and unfortunately I was out of town when it happened, but they were saying over the past decade, 584 individuals have been connected to LEAD, and 78% of that attained permanent housing. 34% showed improved mental health outcomes. 64 were not arrested within 1 year of the initial LEAD engagement. 66 had no criminal conviction within 5 years of LEAD. These are statistics that just don't get out, right? And even myself, I had to look at it. I'm like, what is our success rate? Because I didn't know either. I'm like, what's the outcome? And why isn't this like, this is the story? I guess it doesn't sell the news, right? This is the stuff that should get out. 80% did not experience incarceration within 5 years. That's huge, right? We just hear about that 1 or 2%. And I don't care whatever program you run, whatever the impact it may have. There's always going to be that percentage of failure, right? But I agree with what you're saying, and this is one thing I do enjoy watching you. You have no problem like saying, "Hey, we got to work together." You reach out on different times when you're looking at doing the mental health professionals in the police department. You want to try to do something. You've collaborated with us on a variety of programs, more so, and I'm not taking away from any other chief. We worked with them, but not to this level. I'm like, I wish you could stop asking us for stuff, right? But I give you credit because you're like, hey, if I don't have the resources, I'm going to find it, or if I can improve what we're doing, we're going to change it, and then have you to partner with mental health in the police side, in educating people, because that's half the battle, right? Educating people, the my constituents, but the people you both represent.
Even our staff. You've talked about the learning curve with your officers. We're still learning about bringing services to the street. Everyone that works in mental health is trained as office-based clinicians, but we're out there meeting these people where they're at, and that had to be learned.
Yeah, doing bringing working with mental health on the street. But before I get into some other stuff, what stands out the most impact you think LEAD has on people's lives?
So I think that to the point of meeting people where they're at, I think that what stands out the most for the people that we serve is the fact that we are truly meeting them where they're at, that we are recognizing that people are not going to change overnight. We're not trying to force them to change. So we're understanding that whatever their basic need is, we're willing to try to fulfill that. And that is something that is unique with LEAD. And I think it's changed the philosophy of what, even to the street psychiatry initiative that we're looking to ultimately bring and change how we operate. That we're recognizing that we need to address those basic needs for folks before we ultimately get to the root cause. And I think that's where we've seen the greatest change. And then that is carried over in recognizing for our officers, for our first responders, even for our case managers to recognize that we can't just dive in and suddenly fix somebody's addiction if we're not fixing the most common needs that somebody has. I think that's been the change in attitude.
Health and housing and food and all those things.
It's actually like a wraparound service, right? When you look at it and kind of get into one of the other questions, adapting to the programs. It's changed over 10 years. I don't mean throw a curveball at the two of you, but what do you what would you say 10 years ago where you thought it was and how much it's changed to now, and you had to pivot and change with the times? Every generation's different. Not every kid likes to go to a teen center, do different things. So you had to, and that's why we're still here 10 years later.
But the world has changed. This was a pre-arrest diversion program, and then there was bail reform, and then marijuana was legalized, and suddenly it wasn't incentivizing to divert an arrest. So now we're doing social contact referrals where, you see someone on the corner for 10 years in need. You don't have to wait for them to get arrested. You can get them in the program. To me, that was the biggest transition.
It absolutely was, especially for Albany, because Albany was very focused to start out at trying to divert arrests and trying to make sure we decreased the amount of people being arrested, especially racial disparity. And while we still need to be focused on that, it took a lot of work to try to make sure that people understood that with bail reform, some of which was needed, some of which probably went a little too far, but things that we needed to recognize that, okay, we needed to offer people help ahead of time, and that a charge is not going to be connected to it. And that meant we needed to change the way we were doing things. And that took a lot of talk about the collaboration, getting everybody back together and being like, okay, we need to make a change with how we're doing things. And it's okay to say it's not a failure just because we still have the option to do an arrest diversion, but it doesn't mean it's a failure with the fact that we're going to go out and offer somebody help when there is no criminal charge
before they get arrested.
Yeah, we just need to recognize we're trying to keep them out of the system. They might not be in the system right this second. So I think that's, the curveball was adapting for everybody, and everybody being able to get the mindset change of okay, we are changing a little bit. We have to change with the times. If we don't change with the times, we're not going to be an initiative anymore that's going to help anybody. And then we're going to have a bunch of folks out there that don't know where to turn.
Correct. No, in which I, like you say, I do like joking around with the Albany PD, being a former firefighter. But I see what you go through day in, day out. And all kidding aside, it's it's not an easy job because you're the first ones on the scene. Usually you're there because something bad happened. You're not there like with us with EMS. They might have had some medical condition. You show up when things aren't going right. And, I've watched over the last 7 or 8 years how we've changed the image, and then it became popular to say defund the police. We don't need the police. And then you have your residents that want to see you. They literally want to look out their window and see a police officer out there so they feel safe if they go out on their porch or walk down the store at a grocery store. And some people live in communities they don't want to live in, but that's all they can afford. So it's good to be on the streets, but also to watch the two of you from mental health and expanding that throughout the county, which I was like, can we afford this? Because that's what I hate to say it, when we sit in our seats, whether, whatever position you hold in politics, if you're county executive or town supervisor or town mayor, it's hard because you sit there and you're like, well, here's my budget, but here's a need in the community to make a difference. And I shouldn't say this, only enjoyment I have is watching you, Chief Cox, over the years. Like going to a meeting, I'm like, oh God, I feel his pain, but this is great watching someone else go through it. When you're trying to not just win the politicians over, the community, and saying, hey, look, you got to give it a chance to work. And you stuck to it, though. And Dr. D, the same thing with mental health and convincing the legislature. We are the biggest body of legislatures in the state of New York, actually in the country. But it's not easy. Like, people don't get it. Like, I have to spend more time with my legislature trying to get stuff through. They have more power than I do. And we do have some great legislators that understand, and you got them on board, and then with your program. And then it's still taking the time to, like, even people I think that should know. And I'm like, I'm sitting there taking the time to educate them. And I'm like, look what it's doing. It's making a difference. And you can't talk about them stories because you don't know. If they don't reoffend, it's like I was saying earlier in this conversation, that could be $50,000 you just saved. It could be $500,000 if they got in car. I don't know. I'll be honest. I don't even know what it costs to imprison someone for life. But then they're getting, the healthcare, dental, all that stuff in the jail. That adds up, right? And it's so this outcome to me, for the amount of money when it comes to, and I'm saying this as budgets are going to come tighter. These are programs we got to stay wrapped around that we can't lose. I seen it in the 80s with a crack epidemic, and then what happened? We beat it supposedly, and then we stopped talking about it, or we were like, oh, we don't need a program, it's great. So I love the commitment from the two of you. But what would you add to that?
Well, I would just say that the biggest obstacle that we have, and I think we share to some degree, is the lack of education in the community, the stigma about people who are suffering, people who commit crimes. I've learned, I grew up, my father was a cop. I almost became a cop. But there's always this idea about those people with mental health problems, those people with addiction, those people who commit crimes. They are us.
Correct.
They're our loved ones. They're our neighbors.
It doesn't discriminate against them.
And that's the biggest challenge we have. We're always trying to bang on that because those are our fellow humans.
Yeah, and I think we need to make sure that we just continue to build pathways. So whether it's pre-arrest diversion, social contacts, or, to your point, because I know you had a lot of push in making sure that we had access to mental health court at the city court level and the county court level.
Well, it took 5 years.
No, I know, but you kept that battle up to make sure that we did have.
I'm starting to think I like fighting.
So yeah, it's the Irish in there.
Yeah.
But it's making sure that we do have those pathways. That hey, if this hasn't worked, then we have another pathway, because we do ultimately have a population that has needs, and if those needs aren't met, we are ultimately not just failing the individual, we're failing the entire community, and we're going to wind up with a further tragedy, and that's what we're all trying to stop.
Right.
Public safety can be provided in a number of ways. Sure, it can be provided by throwing somebody behind a set of bars, but first of all, that's a finite amount of time. Second of all, that resource that comes at a huge cost in finances. And then third, is that really creating public safety, or is that just a veil of public safety?
Correct.
We're not getting to the root cause.
No.
So let's actually get to the root cause, especially when we're talking about a smaller percentage of people. It might be a very visible set of people, but it's a small percentage of people.
I agree with you. I think most people don't realize, and when I used to be a firefighter, one of the things is when you make an arrest, or we'd have to come in, or it was a medical afterwards, it always turned out that they had, and this actually helped me years later as county executive when we did the open up the pharmacy inside the mental health. When you brought it to us, I was like, this is brilliant. They don't take their medication. And a lot of time they're not trying to be bad people. They're just not on their medication, or they get it and they don't get it filled. And we kind of found out in when G brought us this program, like, yeah, everyone in my office is like, no way, this is dumb. We don't have the money. And I sat back, and if I wasn't a fireman and dealing with the police and fire at that point in time, I'm like, yeah, this makes sense, because every time I did a PCR on somebody, every time we filled that thing, they stopped taking their medication. They stopped taking, and I'm not saying that was the case with everyone, but I would say over 90% of the people, if you look at the statistics, weren't on their proper medication, which the doctors knew they needed to be on, and they just went schizo. And whatever the trigger point was, them within their family or out on the street, and we started to, say, hey, let's try this. Let's just try to fill
Now
it out.
they get it when they leave the building.
Right. And that was the main thing. And I'm like, yeah, this makes a lot of sense. Or they would say, oh, I have it, I just haven't got to the pharmacy, and I don't, you probably see a lot of that, but I just want to say, as we mark this 10-year milestone, what are you most proud of? And I know you've both talked about different parts of this program, but what stands out? Like, if you could take something away, and I know there's always that thing in any story, right? I shouldn't say story, but when you're running a program, there's things I can name almost every program where something really changed me, why I really want to get involved in it, or someone's passion, or seeing what they went through and convinced me. But what would you say, Chief Cox, out of the over 10 years leading it, now coming back to this role, what do you think?
To me, it's. I mean, there's a ton of things, but for me, it's really the fact that there's so many. Because while there are naysayers, there's so many officers that wind up being convinced that this is a tool that they need the options, and so many of those officers come forward and are like, "Thank God!" Either at the very beginning, we're like, "We needed this option. Like, this is something that's too important for us not to implement," or now fight to make sure that we continue to have this as an option, that are like, we can't let this go. We have to make sure that whatever we do, that's sustainable. That's what I'm most proud of.
I get asked often, why do I still do this? And some days it's not that easy to answer that, but hearing one story, meeting one person, seeing the impact that we've had on a life, it renews my hope. I think without hope, none of this works. I'm just impressed over these years to see the committed staff people, the committed people at the PCG meeting, people from your office, Dan, that have sat there for 12 years with us. There are a lot of committed folks, and they're helping people in a fairly dramatic way. So I just have to be reminded of that every once in a while. It's like, oh, that's why I do this.
I know it gets tough at times, right? Let's all be honest here. I mean, you try to change, you try to do different things, and you get disheartened, right? And you want to see more. And that person you want to touch, or you got them through a certain couple programs. It's unfortunately like AA when they relapse, and you're like, you go, you had 4 years sobriety. And the one thing I take away from COVID is a lot of people that fell off sobriety, a lot of people that got into drugs that weren't, a lot of people just sat home and drank while we were shut down.
Or got depressed.
Right, and didn't get past that. And you see the anger still. I don't know about you two. I see the anger on the road and people yelling at me. I'm like, man. But I think it really had more damage on our society. And I'm not a doctor, not a police officer. It's just, this is my own thing saying, wow, it's really changed people's lives, and it's something that didn't go away 6 years ago, and I think it's going to affect us for a long time to come, especially with kids trying to understand what they went through. Dealing with, my daughter went through high school with it, still dealing with her all these years later, and in the issues they had, and the way, missing their proms, or missing this, or not being in person, and not having that social interaction. But it also gets into the policing side of it, and just seeing things happen afterwards. We opened up and as we continue, but I do want to, give you two final word before we end this episode, but I do want to say this, extraordinary Chief Cox watching over the years do this and getting us all on board, because I can say this to everyone who listens to this. it didn't go too well in the beginning, meaning before you started trying to convince us, like, hey, this is a new idea. This was ahead of its time. And you made it work. And same with you, Dr. G, with the mental health for military, doing that. Honestly, being a combat vet, I appreciate that, or training police officers and how you had to train cops over the years, like you said, it was like they went in and they didn't ask any questions. They just took it down and done. And now having that understanding to embrace it differently. That's a whole culture. You had to change for the cohesiveness of the best of the organization. To do what the two of you done is extraordinary. But final words.
I'm proud that this is the first lead program with mental health in the country. I'm proud that we stood up a clinical lead initiative that is getting medications to people on the street. Great staff, partnerships. 12 years, man. I think we're friends. So it's remarkable.
I couldn't agree more. It's a great collaboration, great partners, great friendship, and we continue to innovate. You see the things like Jenny Yuling's doing with Sync, getting all the partners out there, making sure that we're getting on the streets. Just amazing work.
It really is. And I do want to say this again. Thank you to the two of you for everything that you do day in, day out. And not just educating the public, educating the politicians to say, hey, these things are going to work. Believe in us. When, it's hard when you talk about money, resources, personnel. There's a lot of factors that go into it, in which I do enjoy watching you two. You do the same thing. Not so much my sheriff because he spends a lot of our money, but trying to pull it back. But, these are the type of programs we need to highlight more and need to talk about it more. So I thought it was important to have this podcast, and hopefully people listen to this and look at this. Data analytics is data analytics. You two know better than me because you're in the streets. You're in the trenches. I like to say it. I lost it when I was a fireman. You're not out there anymore in the community. You see firsthand the impact it's having, or where the community goes, or you got the pulse of the community. And to come back and to say, hey, we need to change gears, we need to fix it. Sometimes not easy when it was your model, but to sit there and go, hey, do I want it? Be around and make it impact like you have for the last 10 years, or do you want it to fail? So kudos to the two of you. To anyone listening to this, reach out to them if you have any questions. It's a great program. It can only improve. And if there's something you don't like, I say this, I don't mind when people criticize things. I do. I get it all the time. I respect them when it's someone that's actually behind their name, not just the people out there doing the political thing, and listening to them, because everything can make you change or look at it differently to say, okay, I hear your point of view. Maybe we need to do this and pivot. So I would like to thank you both for joining me today and for the work you're doing. For our listeners, if you enjoyed today's episode, be sure to check out other episodes on Spotify and Apple Podcasts and subscribe so you never miss out on any updates. Thanks for listening to Albany County Directs.